Hi, everyone. Our second impromptu interview from the Green Nurse podcast is at ICN. So we have these lovely individuals, and they're going to tell us a little bit more about themselves and their organization. I'll pass it off. So introduce yourself and what do you do?
I'm Rola and I'm a internationally educated nurse. I'm a program manager at Care Center for Internationally Educated Nurses. So being through the process long time in 2010 and integrating into the Canadian healthcare system and roaming around the world from Lebanon, where I actually was born on this beautiful city, Saida, and then moving through my education through the American University of Beirut, and I owe everything to the people who actually taught me. I'm a nurse educator as well. So moving to Canada wasn't an easy process, and becoming a nurse in Canada was a kind of a bit of a challenge, but with challenges comes opportunities, and I'm happy to support all IANs through my position at Care Center for Internationally Educated Nurses. Thank you so much for following. Please join us. Thank you.
Yeah, thank you. Do you want to tell us a little bit about who
Yeah.
you are? You can just,
No, that's fine.
Don't worry,
Hi.
don't be afraid.
Yeah, my name is Ismail Al-Assad. I am an RN. I immigrated to Canada in 2009, and I have been practicing in Canada since then. I am a case manager with Care for Internationally Educated Nurses, and I started as a member, and now I am a case manager with them. It's amazing to see how much the IANs can help to support the healthcare in Canada, specifically in Ontario. This is the region that we serve, and yeah, thank you very much.
Megan?
Hi, everybody. My name is Meghan Wankel, and I coordinate the pre-arrival supports and services program with Care Center for Internationally Educated Nurses. I've been with the agency since 2014 and coordinated pre-arrival since 2016. And it's a federally funded program by the Government of Canada through Immigration, Refugees and Citizenship Canada. So if you are an internationally educated nurse migrating to Canada, to any province and territory, Care Center is here to provide you all the support you can before you land. And we're grateful you're coming to join us here.
Just wanted to thank the three of you for the work that you do. My mom was actually an internationally educated nurse as well. Long story short, she didn't end up practicing in nursing. So I think it's really important that we have initiatives like yours to retain nurses, to use the skills that they have. So I'm just wondering, from each of your perspectives, what do you think is the most rewarding part of your job? And I'll start with you, Rolla.
Thank you, Sarah, and thank you, Annie, as well, for giving us this opportunity today. The most rewarding part is that a newcomer, as a nurse, an internationally educated nurse, is to go back to practice, is to become a nurse in Canada, because that's why initially they migrated to go back to their profession. Once a nurse, forever a nurse, and IAN's success is our success, and I wouldn't be doing anything else in Canada except nursing, and that's what I determined to do. Determination, keep up to your values, and really value your profession and talent, and we're here to support you. Thank you.
Thank you.
What was the question again?
What is the most rewarding part of your job?
Yeah. What's the most
Well, a lot actually, but meeting people from all over the world. Canada is a big place, and we have so many people from so many countries. They're all Canadians, and they all speak different accents, and we all do. And I feel so happy to learn about the cultures, respect those cultures, and treat those people. They're all Canadians, but with different cultures. So that's interesting. Yeah.
Well, I think I have the best job in the world because nurses. I get to work with nurses from all over the world before they land in Canada. And it is a really complex licensure process, and things are changing now for the better. But it's been very gratifying to connect with people as early as possible, get them started on the licensure process, get them familiar with the Canadian healthcare sector and the cross-cultural norms. So it's just been very rewarding to watch people on their journey. And just to echo my colleagues, when people get their registration and move on to employment, it's very gratifying for us.
Amazing. And so quickly, just wanted you to let everyone know where they can find you if they're interested in your organization and learning more about you.
I can answer for us. You can visit www.carefornurses.org. That is www.care, the number 4, NURSES.org, and that will bring you to our homepage that will tell you about both our pre-arrival Pan-Canadian program and our post-arrival program that is solely in Ontario.
Thank you so much for interviewing with us. We wish you the very best at the rest of this conference, and thank you for all the work that you do, truly.